With horror tales coming out about the hurricane, about snowstorms, one group that is so urgent to the care of people, the hospital situation. I know in Manhattan, in our own backyard, 2 major hospitals had to close. John Lloyd is the president and chief executive officer of Meridian Health, and Meridian Health hospitals and personnel were literally in the eye of the storm. Many of the people connected with this hospital, from doctors, nurses on, without power. And yet they still had to be there to take care of the thousands of patients, unprecedented numbers coming to the hospitals. People who lost everything were still working through it. So welcome, John Lloyd. And what has been going on? You're one of the leading not-for-profit hospital and health care providers. You've had a really hard time, but everyone is in there pitching.
Hi, Joan. Yes, we certainly have. And all of us, our thoughts and prayers go out to all those individuals who've been devastated by Hurricane Sandy. Our big challenge in healthcare is to make sure, number one, is that we have power. And like most everyone else, we didn't have power during the major parts of this storm, and in some cases we still don't. All of our hospitals depend on emergency generators, and fortunately they all worked very well. So we were on emergency generators for days at our hospitals. And although that enables us to take care of our patients, it does limit some of the things we can do in terms of elective surgeries and things like that. Our nursing homes were also on emergency generators, and a few are still on emergency generators today.
And I was told by people who live in the area that the volume of patients you were receiving was almost unprecedented.
The volume was enormous. In some cases, in our emergency rooms, we had 3 to 4 times our capacity in the emergency rooms. An example, in our tertiary center, Jersey Shore, at one time we had 155 patients being treated at one time in the emergency room, and as many as 60 patients coming in every few hours in addition to that. Most of our hospitals were full. We had no beds available. What happens in a horrific storm like this is everything becomes complicated. So for us, for instance, our physicians' offices didn't have power, so patients couldn't go to the physicians' offices. We had patients who couldn't be discharged in the height of the storm because we couldn't get a hold of their families, or they couldn't get a hold of their families. We had other patients who sought us out as a last refuge. We had patients who typically would be at home on oxygen concentrators. They were seeking our help. So at one time, everybody sought the help in our hospitals, and literally for days, we had no available beds. We had patients awaiting to be admitted. Our emergency rooms were overrun, and yet our physicians and nurses do what they always do in an emergency, and that is they were there for the patients, and they took care of the patients.
I'm talking to John Lloyd, who's president and chief executive officer of Meridian Health. And of course, what people have to understand is that your doctors, your nurses, your staff, they were as wounded as everyone else, losing their homes, their cars, and many of them still have nothing.
Yes, at Meridian we have about 12,000 team members. We don't know the exact number, but I would probably guess 5 to 10 to 15% of our team members probably had some devastation on a personal level. And you're right, yet they were there for our patients, and they are always there for our patients. The other thing is the Commissioner of Health, Mary O'Dowd, the Commissioner of New Jersey, and the Governor did a phenomenal job responding to our needs in healthcare, and particularly in the 2 counties in Monmouth and Ocean where we were devastated. They were accessible to us. They made decisions. In fact, they have a mobile satellite emergency department. There's one in the state. They deployed that down to Monmouth and Ocean County, to Brick. That served 4 hospitals during the height of the storm to relieve some of the capacities in the emergency department. They also knew that physicians and nurses needed to have gas for their cars. So they opened up Department of Transportation fuel depots.
That's a great
24/7 to our nurses and physicians. They did so many things for us, and I just want to commend the Commissioner, Mary O'Dowd, the Assistant Commissioner, Chris Wren, as well as the Governor, for taking care of our patients in Monmouth and Ocean counties.
And John, I'm talking to John Lloyd, who's president and CEO of Meridian Health, which, as all of you know, is absolutely one of the largest in the state of New Jersey and among the top performing health systems and been recognized all over. Is it getting any better? I mean, the people who lost still have no places to go, and many of them can't get into their homes.
It's gotten a little better, but we can never sort of relax because there is so much devastation. I still think there are many people that are going to be coming to our facilities. So today we may be only at 85 or 90% capacity, but on a dime things can change and patients might need care. So we're always prepared for the worst, and we're going to be in this mode, I think, for a while. But the good news is that we've all rallied around our patients. We're doing some things for our team members. We gave gift cards out starting last Saturday that gave $350 to some of our team members who were impacted. We're now going to go into a second phase of raising some money to help our affected team members. And just everything that everybody else is doing. We have a clothing and food drive. So we're just all working nonstop for the community, for our patients, and for our own team members and physicians and nurses.
And of course, you know, it's very hard to say to members of our audience listening what you should do before you go to a hospital because, you know, it's hard, as you point out, a lot of the physicians' offices do not have power, especially those, you know, close to the shore areas. So you are in a tough call. You know, they still have to show up at the hospital.
And that's true, and there were some shelters in Monmouth and Ocean County. Unfortunately, those shelters, for the most part, were full. Again, kudos to the Commissioner of Health, who recently opened a regional medical shelter at Middlesex Community College as a way to relieve shelters where there were maybe patients who had very minor medical conditions, didn't need to be in the hospital. If we had that during the storm, it probably would have helped, but nobody was able to foresee that. So I think we all learned from this, but again, the Department of Health was very responsive.
I thank you so much for your service, for your time. John Lloyd from Meridian Health, one of the strongest and most powerful groups in the state of New Jersey. I'm Joan Hamburg. You're listening to News Talk Radio 710 WOR.